We'll have herd immunity by April. That's the bold prediction from Dr. Martin Makary, a professor of surgery at the Johns Hopkins School of Medicine. His Wall Street Journal op-ed projects COVID will be mostly gone in early spring. So let's verify. Do experts agree that we'll reach herd immunity by April? Our sources, 4 infectious disease specialists.
Do you think we could reach herd immunity by April?
April is very optimistic.
It's unlikely.
I think there is no chance we will have herd immunity by April.
No, it's not possible.
Experts tell me at least 70% of Americans need to be fully vaccinated to reach herd immunity. At this point, CDC data shows less than 7% are. But Dr. Makary's op-ed argues natural immunity from infections may get us there sooner. He claims 2/3 of Americans have actually had COVID, and roughly 55% of the country has natural immunity.
Oh, everything was incorrect.
Dr. Ali Mokdad disagrees. He's a professor at the University of Washington's Institute for Health Metrics and Evaluation.
What we do is based on numbers. We're data people.
He points to CDC surveys that show only 20% of Americans have been infected, and he predicts around 20% will be vaccinated by April.
Best case scenario in the United States would be around 40%. That's not herd immunity.
You seem very fired up.
This is not amateur hour.
Dr. Saad Omer is the director of the Yale Institute for Global Health. He also questioned the op-ed, saying there's no way to calculate natural immunity at this point.
That's not the appropriate interpretation of data. There's a reason why you won't see experts who have been working on infectious disease sort of going around making these kinds of predictions, because there is genuine uncertainty.
And that gets to a key point of contention. What's causing the current decline in cases? Dr. Makary argues the only explanation is natural immunity from infections. But Drs. Mokdad and Omer say it's actually human behavior.
Americans did what it takes to bring this pandemic down.
Their data shows mask wearing is way up and travel is way down.
So there is substantial impact of voluntary response combined with social distancing restrictions.
The lockdown and the behaviors did it.
Our experts all agree cases and deaths should keep dropping, especially with the weather warming up, and we may see looser restrictions as a result. But they say it could reverse quickly with new variants.
All this success story that we see right now is so fragile. It's so dangerous to talk about herd immunity in April and in May, simply because we have new variants that are making the vaccine less effective.
So we can verify our experts do not agree that we'll reach herd immunity in April.
Even if the trends bear out, the rationale is important because that reasoning that tells us what happens next and what strategies we need to apply.
With your Verify, I'm Gabe Cohen.